County Health Department. Thank you for joining us today. It's 3:30 p.m. on February 11th, 2021. With us today, we have Edward Rivers of the Scott County Health Department and Nita Ludwig of the Rock Island County Health Department. Let's start off with some Rock Island County cases first, please, Nita.
Sure. Today in Rock Island County, we have 33 new COVID-19 cases, and our total is now 12,544. We are unfortunately reporting one additional death of a woman in her 70s who was hospitalized, and we are sad to see another county resident that has passed away from COVID-19, and we offer our deepest sympathies. The total number of deaths in our county now is at 302, and 13 people are currently hospitalized.
In Scott County today, we have had 16,636 cases, and our deaths are 194.
Okay, Nita, let's go with your talking points, please.
Take myself back off mute. The Illinois Department of Public Health has made 2 changes to the vaccine rollout plan this week that will have serious impact on how and when doses will be available to the majority of our residents. First, local health departments will be allocated fewer first doses of the vaccine to make sure that everyone who has already gotten their first dose will get their second dose too. By now, national and state public health leaders had expected that the vaccine would be more plentiful and that second dose shipments would arrive in time for second doses and match the number given. This has not been the case, however. Our allocation remains small. As of this briefing, we do not know the number of doses yet that we will receive for next week. We know that we will have 900 set aside for Tuesday's clinic coming up, and any remaining doses will be shared with our partners, including community health care, for their weekend clinics. We already set the second dose priority for next week. Tuesday's clinic is for those who received their first dose at our January 19th clinic. Everyone who got their first dose then should have been able to sign up for a slot by 3 p.m. When I looked just before this briefing, there were still a few slots left. Any slots that remain will be posted on our Facebook page and on our website at 10 a.m. on Friday for first dose opportunity. We suggest going to the Facebook link each time that we post this because the social media network has the capacity to handle the volume of traffic. We plan to follow this pattern on Thursday, second dose opportunities, followed by Friday, first dose opportunities for the foreseeable future. This change by default will reduce the number of opportunities for people to get that first dose through us, but there is some good news. Our pharmacy and healthcare partners are starting to get shipments directly from IDPH. Unity Point, Trinity, Genesis, and Community Healthcare are starting to reach their own patients. However, our partners strongly request that patients do not call the providers' offices and instead wait to be contacted by them. First dose slots could be available at Hy-Vee.com, Walgreens at Walgreens.com, or Jewel Osco, and their link is Albertsons.com. The bottom line is that we still have more people that want the vaccine than we have doses available, but supply and the number of ways to be vaccinated are growing. The second major change is both good and difficult news. Starting February 25th, IDPH is opening vaccine opportunities to Illinoisans with certain underlying health conditions, including cancer, chronic kidney disease, chronic obstructive pulmonary disease or COPD, diabetes, heart conditions, immunocompromised folks from a solid organ transplant, obesity, pregnancy, pulmonary disease, and sickle cell disease. As you can imagine, we are pleased to be able to offer vaccination protection to people with these more serious health conditions. However, we are worried that expanding eligibility without greatly expanding supply will lead to even more frustration. We are trying to manage your expectations. You will have a chance to receive your vaccination, but you could be weeks away from getting a time slot at one of our clinics or with our pharmacy partners. Please understand that public health and our partners are working very hard on your behalf, and that this process is frustrating to all of us. Just this afternoon, we have learned that Illinois had its first case of COVID-19 variant B1.1.7, which was first identified in South Africa, and it has been detected here in Rock Island County. Having this new variant in our community underscores the need to take the personal precautions to prevent further spread. Please continue to wear your mask, watch your distance, and wash your hands frequently, as we have said all along. And now for the good news. IDPH is tracking how many doses are given in each county and bases it on each county's total population. IDPH shows that more than 13,500 doses have been administered in our county, and that almost 3,000 have gotten both doses. We have to trust IDPH numbers in our county because many of our partners are reporting into the state system. When allowing that children are not yet approved to receive the vaccine, if we take those away, then almost 12% of our eligible county residents have received at least one dose of the vaccine. This is a Herculean effort, and we are proud of our staff, our partners, and our volunteers. We thank you for your continued patience and understand that this process has been frustrating at times. We're frustrated too, but knowing that almost 12% of people have had at least some protection from this virus gives us hope that eventually we will be able to enjoy all that life allows. Until then, please continue to wear your mask, watch your distance, and wash your hands. Each dose given brings us closer to what we all desperately want. Thank you very much.
We announced on Tuesday that of the doses of vaccine that Scott County receives, the supply for the 65 and older community will be given to Genesis, Unity Point Health Trinity, and Community Health Care to be administered through their clinics. These health systems have plans in place to get that 65 and older population vaccinated. If you're a patient of these health systems, please do not call your doctor to get scheduled. You will be contacted to schedule a vaccine appointment when it is your turn. If you tried to contact CASI, please be patient. Tell them you want to tell them you want to receive a vaccine. Leave a voicemail with your name and number. Their staff will be in touch with you to gather information. They are receiving a high volume of calls and are working their way through those who have reached out. For people who have already received a first dose of vaccine from one of the Scott County Health Department's clinics at Sears, our announcement of vaccine going to healthcare providers does not affect you. We will be giving you your second vaccination and will be contacting you via email for your second dose. People who have scheduled appointments for first and second dose vaccines through Walgreens also won't be affected by this change. The limited one-time supply of vaccine Walgreens had available is independent from what we receive for Scott County. As a reminder, Scott County is receiving approximately 2,250 doses of vaccine per week for the entire county. As much as we would like to vaccinate all of our 65 and older population and the phase 1B tier 1 populations quickly, we're still just in week 2 of this phase. It's going to take a number of weeks with this level of vaccine supply. Whether you are vaccinated, hope to be vaccinated, or won't be vaccinated, wearing a mask is just as important now as it has ever been. Please continue to mask up when you're out and about and around others of your household. Please continue to social distance when you're around others. Please avoid large group gatherings and events. We are fortunate that our daily number of cases has decreased. However, there are new variants of the virus, just as Nita has noted earlier, that are circulating, and these are reminders that the pandemic isn't over. It will take a number of months before those public health measures can be relaxed. For the time being, let's keep doing what we're doing to protect us all.
Thank you, Ed and Nita. Today with us we have Dr. Katz, who has asked to say something. Please go ahead, Dr. Katz.
Can you hear me?
Yes, we can.
Oh, okay. No, it got cleared up in the chat room. I was a little confused about some of the variant designations, but it's cleared up, so nothing to talk about.
Do you want to weigh in on your concerns about this virus in the community, or this strain in the community?
Well, yeah, it's I had a piece in the paper the other day that kind of laid it out, the 351 from South Africa. There's some early evidence, certainly, that it may escape the monoclonal antibodies that we're using as one of the effective treatments. And there's concern with all the variants, but that one specifically, that the efficacy of Pfizer-BioNTech may be slightly less for the South African variant than for the wild type virus that's been circulating in the US and locally. So it really, the strong message is what Ed just told you. It is inappropriate at this point to back off on any of the non-pharmaceutical interventions that we've been recommending now for almost a year. We really do need to double down based on what we don't yet know about the variants that have found their way to the US and the Midwest. That was it.
Thank you, Dr. Katz. We appreciate that insight. Let's go to the chat. Nita, this is for you. The first dose rate is good news, but don't we want to count children and population as a goal for herd immunity? And then there's a second part too.
Okay, well, sure, we want, the general population to eventually have immunity so that we're all protected. We just wanted to share that our numbers of vaccinations is really better than it may appear, because those numbers of children are included in that. So removing them, we are at a higher number vaccinated at this point in time.
And just a reminder that no one under the age of 16 is been approved to have the vaccine. And so that's for Pfizer, I believe. Dr. Katz, correct me if I'm wrong. And the Moderna is for 18.
That's exactly right.
Thank you. And then I guess the second part of that question, Nita, was just a comment to say the second dose rate in Rock Island County has climbed significantly. Let's see. Okay, this is to both of you. What factors do you think have contributed to the lowered number of new cases? Does this tend to show the importance of wearing masks? Ed, what do you think?
Well, certainly wearing masks are important. It's one of the few things that we can do to protect ourselves other than just staying away from people. Our peak in Scott County was in November, began to decline after that, and it's fallen off pretty dramatically after the first of the year. I hope that's due to the fact of constant messaging by the health departments about what you should do, and then there has to be some realization of our citizens that this is real. We've been saying all along that if you don't know somebody who's had it now, you will soon. And that was probably brought home very dramatically during the peak in November when we had well over 6,000 cases, and in one day, over 425 cases. So it's probably a combination of factors.
Okay. Nita, would you like to add anything?
Well, I would just like to add that, we have seen a peak and then a decline earlier in the year, and now we're on the decline again. So really to just stress to follow those recommendations that we've been saying all along about masking and social distancing and hand hygiene, because we do not want that to go back up again.
Okay. And just a note to Ed and Nita, your cameras are off. So is it safe to say that these variants could prolong the pandemic? Nita, what do you think?
Well, I think maybe Dr. Katz would be better to answer that, but I would, I would hope that as we get more and more people vaccinated, that this will help reduce the spread of all the different forms of COVID-19, and that, we'll put this pandemic behind us in the future.
Dr. Katz, would you like to weigh in?
Yeah, I can think of a scenario that the variants affect the epidemic curve in any of a wide variety of ways, and one of them, of course, is to extend the pandemic. If we evolve strains that effectively evade vaccines, then that increases the susceptible pool to include some or all of the people who right now have vaccine-induced immunity, and so they may be prone to reinfection. We've seen in Brazil, with the P1 strain in Brazil, that in communities where 70 or 80% of the population had already been infected, that Brazil strain produces second infections. So yeah, it could extend things. But remember, the virus is incapable of evading appropriately used masks and social distancing. So as we keep saying, it is inappropriate at this point to back off on masking, social and physical distancing, hand hygiene, avoiding crowds, all the things we've been talking about essentially since February and March last year.
Thank you very much. Nita, the next question is for you. What details can we share about the person who is the first in Illinois to have the variant from South Africa? What about travel, and what about contact tracing?
Sure. Well, I can't share very much information about that, as it is protected health information on that person. But I can say that we are still investigating that case, and our contact tracing is occurring right now with that case.
Okay. That is the end of the questions in the chat. We'll pause here for a few moments to see if there are any other ones. Otherwise, I owe you a Rock Island County case count email. You should have that very shortly. And we will send all this information out in the after briefing media release. There is one correction that we need to make. We cited the wrong number of the variant. It is the B.1.351, and I'll send that out in the after briefing release. I see no other questions, so we're going to conclude for today. We expect to speak to you on Tuesday. Have a lovely weekend, and we'll talk to you next week. Thank you.